to quickly come to Lucy and Leena. Would you like to comment on this? If like, do you think does the UN even understand what access means in the lower middle income countries?
Well, I think they do because the ministers of health do describe situations and depict them with histories, the stories about their own countries. However, it's a multilateralism. It's many countries working together, and every country is pushing for a different reality, and the agendas are different. Despite we are trying to work together, uh,
Mm-hmm.
the final results will depend a lot on the money
Yeah.
that, or the influence that that money has in the global scene. So
Mm.
who cares if there are many people going through a very bad situation with certain disease in ex low and middle income country? If we are more focused on making money somewhere else and building a narrative that's powerful enough to provide a lot of money for pharma worldwide, it's complicated. It's complicated, and well, I have to agree with James in what he mentioned about especially Type 1 diabetes being an ignored disease, but just due to lack of education or ignorance, because when people hear diabetes, as well as mentioned, as James commented, they immediately associate it to lifestyle, and there's a lot of blaming and shaming, putting the like the fault on the person living with diabetes, even
Mm-hmm.
for obesity, when it's a way more complex policy issue that starts with the taxation and production and regulation of ultra processed food.
Mm.
So it's way more complex than just blaming the patient. There's a lot to it.
Mm. Leena, Leena, would you like to comment on this?
Yeah, so just a sort of analysis on this that I wanted to sort of share is that UNHLMs traditionally have been organized to set targets for low and middle income countries, to be very honest, because, for example, if you look at HIV drugs, antiretrovirals, they were already available in the West
Mm.
and they were not available in LMIC. Similarly,
Mm.
we've seen this with TB, we've seen this with other diseases. So
Yes.
I don't have a problem with that. What I have a fundamental problem is that actually activism fuels change, and how do you build activism? You build
Mm.
activism by going to court to ask for the right to insulin for people with diabetes who are insulin dependent, type 1, type 2, and sort of gestating these battles, which are very
Mm-hmm.
important, because even
Mm.
within India you have the richer states and the poorer states and a double standard, and different strokes for different people, right? So I just wanted to say this, that we have to gestate this. We have to make
Mm.
those links, legal rights links to children, for example, who have diabetes and have to go to school, and
Yeah.
between schools denying them admission because they feel it's too complex to manage a child with diabetes, fighting and getting the education ministry to issue the necessary regulations, but
Mm.
also fighting to get the technologies for kids
Yeah.
who need it in school. So
Yes.
I think we are at a very crucial point, that if we want the UNHLM to be a strong political declaration in our favor, then we'll
Mm.
have to create the activism for it. And
Yeah.
activism comes from two ways. Either people march or they go to court. And when we
Mm.
go to court, we mobilize around the court case. So this is what
Yeah.
I would say. And the last thing I wanted to say is this, that, pushing back on double standards and explaining what double standards means in diabetes is absolutely crucial. And I saw this huge battle when MSF first put out the pen message, when people would just walk up to us and say, human insulin is good enough. And we would just go hammer and bang. And then suddenly we would say, sorry, this is a double standard, and the language changed because they got scared that you're telling us, you're accusing of double standards, which,
Mm.
implies a certain level of discrimination being built into it.
Yeah.
And lastly, I think we need to look at what James said, that different states are different strokes. So some countries are flush with money for health, and
Mm.
some countries are going through a debt crisis.